Welcome back to the Conquer Your Lower Back series. This is episode 3 and today we are going deep. Not into stretches or exercises, but into your own anatomy. Understanding your body, especially how your lower back is structured, is a powerful way to reduce fear, debunk confusion, build trust, and actually support long-term healing. You will walk away from this video knowing what your spine is made of, what each part actually does, why pain doesn't always mean damage, what common conditions really look like, and how to start thinking functionally, not fearfully. Let's begin with the foundations. Your lumbar spine, the architecture of your lower back. Your lower back or lumbar spine is built for strength, shock absorption, and movement. There are 5 lumbar vertebrae, L1 to L5. These are the biggest bones in your spine because they carry the most load. Each vertebra is shaped like a block with extensions designed for movement and stability. Each one includes a vertebral body, which is the big thick front portion that bears load, a spinal process, which is the spine bone that you can feel down your back, a transverse process, which are the side rings for muscle attachment, facet joints, which guide movements like hinges, and a vertebral foramen, which is the hollow tunnel for your spinal cord. Between each bone sits an intervertebral disc, which brings us to one of the most misunderstood structures in back pain. Discs are shock absorbers made of 2 main parts: annulus fibrosus, which is a tough fibrous outer ring, and a nucleus pulposus, which is the soft gel-like inner core. A common analogy is jelly donut, but unlike donuts, your discs don't slip out. It is anchored by ligaments attached to the vertebrae above and below and designed to deform and recover. A fun fact is, discs can reabsorb bulges naturally over time. A large meta-analysis by Zong et al. In 2017 found out that 60% of lumbar disc herniation regresses without surgery. The discs thrive on movement. They are avascular, meaning they don't have blood vessels, so they rely on movement to stay hydrated and nourished. After sitting for hours, your discs dry out temporarily. That's why walking or stretching is important, because by doing that, they are rehydrated. Behind the vertebral body are your facet joints. These are pairs of small joints that guide motion segment by segment. They control extension, that is bending backwards, and limits excessive rotation and prevent shearing forces. Facet joints are common sites for stiffness or local inflammation, especially after long sitting or awkward movements. But they are not fragile. They respond well to mobilization and smart loading, nerves, signals, and sensations. Now let's talk about the real communication highway of your spine, which are the nerves. Your spinal cord ends around L1 to L2, transitioning into a bundle of nerves called the caudal equina, which is a Latin word for hostile. Nerves exit through openings called intervertebral foramina and branch into sensory nerves, which carry signals such as touch, pain, and temperature to your brain, and also motor nerves, which tell the muscle to move. For example, nerves exiting around L4 to S1 affect your glutes, your hamstrings, your ankles, and your feet. If these nerves are compressed or irritated from disc swelling, inflammation, or muscle tension, you might feel tingling or numbness, weakness, or sciatica, which is a shooting pain down the back of your leg. But here's the kicker. An MRI might show a disc bulge near a nerve and you feel no pain, or vice versa, severe symptoms but no clear compression. This is because your brain interprets the signals. It decides whether something is dangerous, and pain is an output of the interpretation and not the input of tissue damage. That's why I keep saying that pain does not always equal damage. Pain equals perceived threat. Muscle systems that support your spine. Your muscles are smart and reactive. Muscles don't just generate power, they also protect you. When you're in pain, they tighten to guard the area. That's helpful in the short term, but the long term, it can cause more tension, fatigue, and hypersensitivity. Let's look at the key players. Multifidus. These are tiny muscles but mighty. They are the deep stabilizers that sit right next to each vertebrae, inhibited quickly by pain and often stay weak long after pain goes away. That's why rebuilding multifidus activation is crucial in rehab. Transverse abdominis. These muscles wrap around your abdomen like natural weight belts. It stabilizes you before you move when working properly. Pain and bracing can delay or block this response, causing instability. Erector spinae. These are large muscles on each side of your spine. They help with upright posture and extension, like arching your back. Often overworked when stabilizers switch off. Then we have the glutes, hamstrings, and hip flexors. These don't attach directly to the spine, but they control pelvic movement. Weak glutes or tight hip flexors increase lumbar load, affecting disc pressure and joint stress. This is a side clinical note. In persistent low back pain, we often see underactive stabilizers and overactive superficial muscles leading to bracing, fatigue, and ongoing tension. Fascia, joints, and force distribution. You are not a skeleton with muscles glued on you. You are a living tension system held together by what we call fascia, a connective tissue that wraps every muscle, nerve, and organ. Fascia and the thoracolumbar system. The thoracolumbar fascia is a deep fascia sheet that connects your glutes, lats, spine stabilizers, and pelvics. It transmits force and coordinates movement across your posterior chain. When fascia stiffens from stress, immobility, or guarding, it contributes to tightness, reduced movement, variability, and even referred pain. Your spine is loaded all day long. Standing compresses your discs by 100 kilograms, and sitting poorly increases that by 140 kilograms. Lifting with poor form takes it way above 200 kilograms of compressive force. But load isn't the enemy. It is the mismatch between load and capacity that causes problem. You don't need to avoid load. You need to build capacity for it. Common conditions explained simply. Let's demystify a few terms you have probably heard. Disc bulge or herniation. This is the inner disc material pushed outward. It's common in people aged between 20 and 50 and often resolves with conservative care. Symptoms may include leg pain, back pain, which becomes worse with sitting, bending, and coughing, and better with walking. Research by Zon et al. In 2017 shows that 66% of disc herniations shrink or reabsorb over time. Spinal stenosis. This is the narrowing of the spinal canal, often in older adults, and has the possibility of compressing nerves. Symptoms include leg heaviness, numbness, and weakness, which becomes worse with standing and walking and is relieved when bending forward or sitting. Facet joint irritation. This is a small joint inflammation in the spine, often localized low back pain. Symptoms include sharp pain with aching backs, pain on one side more than the other, and no leg symptoms. Sacroiliac joint dysfunction. Joints between the sacrum and the pelvis can refer pain to the buttocks or back of the thigh. Symptoms include pain with standing, from sitting, one-sided deep ache, sensitive pelvic compression, scant movement, and nervous system. MRIs are snapshots, but pain is a real-time experience. Jensen et al. In 1994 states that studies show that 52% of asymptomatic people have disc bulges, 38% have degenerative changes, and 27% have disc protrusions. Scans don't show muscle inhibition, sensitization, movement patterns, and emotional context. They can help rule out serious conditions, but most back pain should first be assessed functionally by how you move and not just by matching the brain in back pain. Your brain weighs every sensation against your emotions, beliefs, and environment. If you fear movement, believe you are damaged, avoid activity, your brain might be amplifying pain signals even when tissues are healing. This is called central sensitization. But just as the brain winds up pain, it can also calm it down through movement, through education, through graded exposure, and through confidence and context. Let's recap what you now know. Your spine is strong, dynamic, and adaptable. Discs aren't fragile, they deform and heal. Muscles matter, especially deep stabilizers. Load isn't bad, mismatched load is. Pain doesn't equal damage. Scans don't show everything. The brain plays a huge role in recovery. Understanding your anatomy isn't about memorizing structures. It's about making peace with your body. You are not fragile. You are not broken. You just need the right information at the right time with the right approach. If this helped you, please comment below and share this video with someone stuck in the fear or confusion about their body. You deserve to move well, feel strong, and live freely.